What good is money if it can't buy happiness? Ladies and gentlemen, knowledge of the conjugal relationship such as underground resources that people are still looking for and exploitation. Every day is adding new findings. Surprise. Online dating. You would like to share experiences about life, love, marriage and family. Today online dating, the liberty to send you the content. Online dating, 5 pregnancy tips for having healthier babies. Babies interact with the world before they're even in it, so give them the healthy head start with these tips. Getting ready for a baby is no small responsibility. Besides the obvious prep work of readying the nursery to setting up a college fund, parents can make crucial decisions to improve the health of their baby at any stage, even before he or she is conceived, according to research published in the American Journal of Clinical Nutrition. In a systematic review of 2,300 studies on dietary interventions along various stages of pregnancy, the researchers found that food definitely matters. While it is clear that diet when pregnancy can affect immediate outcomes, far less is known about diet around the time of conception or the consequences for the child's health in later life, said Keith Godfrey, Ph.D., one of the researchers from the Medical Council Lifecourse Epidemiology Unit at the University of Southampton in the UK. Getting maternal nutrition right may require ensuring that all women have access to adequate diets before conception, not just during pregnancy. Knowing that mom's diet and environment can be critical for her baby's development, here are 5 tips to improve your chances of having a healthier baby. Snack on yogurt instead of reaching for sugary ice cream when a snack craving hits. Try yogurt instead. Okay, so it's not exactly the same, but you and your baby will thank you later. Research from the journal Epidemiology found that probiotic-rich yogurt containing L-rhamnosus had a protective effect against mercury and arsenic in pregnant women. Reduction in these compounds in the mothers could presumably decrease negative developmental effects in their fetuses and newborns, says Gregor Reed, Ph.D., from the Canadian Centre for Human Microbiome and Probiotics. Instead of buying yogurt that's more sugar than dairy, try making it yourself with this recipe. Take vitamin D supplements. If you're not getting enough vitamin D from dairy, consider supplements. While old research convinced doctors to keep pregnant women away from vitamin D supplements, emerging research is coming forward that indicates this shouldn't be the case. The low amount of vitamin D 400 international units, or IU, 200 IU for pregnant women that was set 50 years ago was never set scientifically, says Bruce Hollis, Ph.D., professor of pediatrics at the Medical University of South Carolina. There was no science behind it, just intuition, says Hollis. It's a reasonable level for an infant, but left adults totally in peril. Hollis' research found that taking 4,000 IU cut the rate of pregnancy complications including high blood pressure and preeclampsia in half, as compared with taking 400 IU. Since this high level of vitamin D was conducted in a clinical setting with regular urinary calcium monitoring, we recommend consulting your doctor before starting supplements. Ask your doctor whether you should have a vitamin D blood test to determine if you need extra doses of D, says Mark Moyed, MD, MPH, author of the Supplement Handbook. Bottom line, it's important to address calcium and vitamin D needs during pregnancy. I consider a vitamin D blood level of 30 to 40 ng/milliliters on a 25-O vitamin D test to be completely normal. Stay fit. You're certainly not going to lose weight while you're pregnant by working out, but that doesn't give you an excuse to ditch your workout routine. Working out has plenty of other benefits, from boosting your brain power to reducing your depression risk besides just weight loss, and this may be especially true for pregnant women, according to researchers from the University of Adelaide in Australia. They found that maintaining the healthy exercise routine and eating right were associated with a healthy birth weight for the child, reduced the chance of moderate to severe respiratory distress syndrome, and reduced the duration of hospital stays. Rosalie Grivell, Ph.D., from the university's Robinson Research Institute, said, approximately 50% of women are overweight or obese during pregnancy. Until this study was conducted, there had been little evidence about the overall benefits of dietary and lifestyle interventions on this group of women. Avoid air pollution. If you have the chance to get out into the fresh air while you're pregnant, do so. Researchers from the University of Pittsburgh found that higher levels of air pollution were associated with a higher occurrence of autism. The specific pollutants called into question are styrene, chromium, cyanide, methylene chloride, methanol, and arsenic. Our results add to the growing body of evidence linking environmental exposures, such as air pollution, to autism spectrum disorder, said Evelyn Talbot, DRPH, principal investigator of the analysis and professor of epidemiology at Pitt Public Health. The next step will be confirming our findings with studies that measure the specific exposure to air pollutants at an individual level to verify these EPA-modeled estimates. Just keep in mind that if you're going to a farm to escape toxic air pollution, make sure it's an organic one. Previous research has found that risk for autism increases with proximity to pesticide-treated fields. Avoid household toxins. There are plenty of reasons to avoid household toxins, from lowered IQ to hormone disruption, but avoiding plastic bottles, aluminum cans, and questionable beauty products may be even more important during pregnancy because these chemicals can have real effects on your baby. Most recently, research was published in the journal JAMA Pediatrics showing that prenatal exposure to BPA contributes to childhood asthma and a persistent wheeze. Previous research has found similar connections between lung health and prenatal exposure to phthalates. Please click subscribe and like to support the author. And get the latest video about love, marriage, family, video rendering software, audio, video editing software and the other to share in life. Online dating. Thank those of you that job. Respect. Author, Juan N. Hatlin. Gmail, links@gmail.com.